Keeps getting worse. Here's the latest. When VA Secretary Eric Shinseki resigned, he handed Obama a report. It was an audit, and it suggested that VA staff falsified records to collect bonuses at clinics in Phoenix. Typical top-down government-run stuff. Now, a bill in the Senate is aimed at fixing the long delays to see doctors. Among other things, the bill would allow for veterans to seek medical care outside the VA. However, for some VA patients, it's too little too late.
Larry Wilkinson had some testing done on his foot at the Grand Junction VA Medical Center March of last year, but he says he didn't find out the test results until it was too late.
They never called me. They never said, hey, you got a problem.
He says the doctor never told him about the infection that needed antibiotics. And 2 months after the testing, he had to get his leg amputated.
And I feel the VA owes me a leg.
VA patient Richard Worsley says he was shocked to find a bill for more than $8,000 after the VA instructed an ambulance to take him to St. Mary's for heart attack symptoms.
I thought the VA sent me to St. Mary's as part of my health program at the VA, and that they were going to pick up the cost.
42 VA medical centers across the country are now under investigation. It's a mess. And this is government-run health care. It's a preview of Obamacare if it's not stopped. And maybe that's why many Americans are leaving the best health care system in the world, only to use a third world health care system, believe it or not. Joining me now, private medicine advocate and Obamacare expert and Daily Ledger contributor Patricia Newman.
Hi.
Patricia, hi. So Americans, mostly of Hispanic descent, are heading to Mexico to get treatment. That's a fact.
They are. Historically, Latinos like going down there to Mexico. It was very common in the past, and then, as you know, with all the violence and the narcos there, especially in border towns, that stopped. Also, because there were big scams about 5 years ago, they found that a lot of these insurance companies in America that covered patients for services in Mexico were being scammed by some unscrupulous physicians down there that submitted claims for things that didn't happen. So that kind of slowed down the traffic of patients, but now with Obamacare, there's a large increase of patients going down there. The reason being is because as they get these new plans, they find that they can't find a doctor, that if they do, they have to wait a long time. A lot of these laborers do not get sick time days off. So it's cheaper for them to drive down and be seen the same day. Their copays are lower. There's one company that is a multinational company, only one in the whole United States, and it's based out of San Diego, California, that kind of functions like an HMO. And so patients that are covered under that policy, but even those that have Obamacare plans, go down for services. And, a lot of it is cultural, too. They speak the same language. They get to spend more face time with their physician. It's a different experience. And
right. So these are Mexican Americans, largely, who maybe live in Southern California, live in maybe New Mexico, Texas, Arizona, who maybe on their day off from work will drive down across the border to large cities like maybe Mexicali or Nogales or maybe Tijuana, and get services there, even though they're paying the Obamacare premium, so they're basically paying for two services.
Well, they are, but do remember that those out-of-pocket expenses just skyrocketed and copays went up. So by the time they meet their deductible, it's cheaper for them to drive down, see the doctor, pay $40 to $50 for an office visit, same day, no wait, culturally more attuned to their feelings or whatever they like that experience to be. And let me tell you, people are driving all the way from LA to Tijuana to go see their physician. And let me tell you, there are good physicians in Mexico. So it's not like, yes, it is a third world country, and the biggest detriment, I think, as far as the health care of these patients is that it is a poor country. So they don't have the resources for the big diagnostic, machines and labs and MRIs. But the clinical training is very good.
And but it's also cheaper, right? I mean, Americans often will go down and buy pharmaceuticals down in Mexico as well because it's prohibitively cheaper for most drugs. So that's the bottom line here. But this also play into medical tourism. I mean, there's plenty of people who are not Latino who are doing this as well, right?
Exactly. Well, for those that are, one of the things in Mexico is that if you do go seek a physician down there, you really have to do your homework to make sure you've got a licensed physician and not some, crock-pot, because that does happen. But so there's this new market. The medical tourism is really growing, and some of these are even housing the medical facilities in ships, big, long, boats, where you really are not anchored to any country, and all the regulations that may apply from different countries do not apply when you're at sea. So you're getting a lot of physicians, American physicians, that are licensed and do not want to deal with Obamacare regulations and reporting and medical record sharing and all of that stuff. So they're going on these cruise liners to provide health care, and some of them are setting up big, large, state-of-the-art hospitals in Caribbean islands. I mean, this is getting pretty fancy, and it still would be cheaper for somebody that's paying cash out of pocket with a huge deductible to do that and get a vacation, get a medical care, than to do it here.
Well, isn't it ironic, though, that you have the people from Canada, the Canadians, coming down to the U.S. for treatment, and then we have Americans going down to Mexico or maybe the Caribbean for treatment?
I think the Canadians are joining the Americans going outside of the U.S.
They're just skipping us all together now,
But you know what? The good thing about this long term is that it does create competition, because that is a free market. And if we don't wake up, they're going to be better than us.
Oh, yeah. It could easily happen. Patty, thanks for all that.
Thank you.
Coming up next, the mother of the U.S. Marine being held in Mexico as the Daily Ledger continues.